This is a movie of modern phacoemulsification surgery. First, a side port incision is made. 1% preservative-free lidocaine is placed on the surface of the eye and in the anterior chamber of the eye. Next, viscoelastic is placed in the anterior chamber of the eye to protect the corneal endothelium during surgery. A near clear corneal incision is then formed with a 2.75 millimeter microkeratome. The capsulorhexis is initiated with a cystotome. The capsulorhexis is then completed using a Uterata forceps. Hydrodissection is used to free and spin the nucleus. The phacoemulsification handpiece and a chopper are then used to remove the nucleus. This is done using a stop and chop technique to groove the nucleus centrally, crack it in half, and then remove it in small pieces. As the last quadrant of the nucleus is removed, you can visualize that there's very little cortex remaining as cortical cleaving hydrodissection was used. An irrigation and aspiration handpiece is then used to remove the remaining cortex from the eye. The posterior capsule is then polished with the irrigation and aspiration handpiece. Viscoelastic is again used to fill the capsular bag to prepare the eye for lens implantation. The lens is inserted through the 2.75 millimeter incision. In this case, the lens is an AMO model Z-Cebu single piece acrylic intraocular lens. It is positioned in the capsular bag, and the haptics are unfolded using a Drysdale manipulator. The viscoelastic is then removed from the eye using the irrigation aspiration handpiece. Here I go under the lens to remove any residual viscoelastic from behind the lens, and the lens is centered in the capsular bag. The incisions are hydrated with balanced salt solution to ensure that they are watertight, and antibiotic is placed into the eye to prevent an infection. Thank you.